In this video, we're going to finish talking about the axial skeleton. So we've already discussed the facial bones and the cranial bones. We've done the skull section here. And so now we're going to move on into the thoracic cage, and we're going to talk about the spinal column. And so we'll talk about the different vertebrae that we have there. So first thing, we have the sternum. That's going to be this breastbone here, and that is going to be made up of three parts. You'll have the manubrium, the body of the sternum, and then the pointy section, which is the xiphoid process. Coming on down, you have cartilage that's going to attach the sternum to the ribs, and that's going to be referred to as costal cartilage. And so anything that you see here that's darker, that's going to be that costal cartilage. We'll talk about that a little bit more later on in this video. Coming on over, we have ribs. So you're going to have 24 ribs total, 12 on each side. And so the ribs are going to be what you see through here. And then we have our vertebrae. And so we're going to talk about the vertebral column. And you're going to have different sections to the vertebrae. So the top section or the neck is going to be the cervical vertebrae. And so there's going to be 7 of those. Coming on down, you'll have 12 thoracic vertebrae, and they come in contact with each set of ribs. And then the back or lower back section is going to be referred to as the lumbar vertebrae. And then you're going to have, with the lumbar, you're going to have 5 there. And then with the sacrum, that's going to be 5 fused. And then the coccyx, which is referred to as the tailbone, that is going to be 4 fused. Now, if you look at this picture over here with this lumbar vertebrae, notice how you have these pads in between each one of these intervertebral discs. These discs here are going to separate those vertebrae. That's what they're referred to, intervertebral discs. They separate the vertebrae and kind of give it a cushion. That way the bone's not on top of bone, and it allows the spine to be more flexible. So looking here, you can see a little bit better looking from the side. So you see your 7 cervical vertebrae. Those are going to be the ones that you find in the neck. Cervic means neck. Coming on down, you see the thoracic vertebrae. There's going to be 12 of those. And so they pick up where the first rib is going to be all the way down to the last rib. Then you're going to have your lower back, which is going to be referred to as the lumbar vertebrae. And sometimes when they refer to the lower back region, they refer to it as the lumbar region. There's going to be 5 vertebrae in this section. And notice how they've taken out those intervertebral discs. So you can see the space that's between each one of these vertebrae without the disc there. Then you come down to the section here, which is referred to as the sacrum or the sacral section. And that's going to have 5 fused vertebrae. And then you come down to the coccyx here, which is the tailbone, or it can be referred to as the coccygeal region, and that's going to be 4 fused. Now with your curves in your spine, at first when you're born, your spine's going to be in a C shape. And so as you start to be able to hold your head up, that's going to create a secondary curve. And so that's referred to as your cervical curve here. And so that one's secondary. The curve in the thoracic section is going to be one that you're born with. So that's a primary curve for that thoracic curve. The lower back curve does not form until you start to walk. So once you start to walk and use those lower limbs, that curve will form. So that's going to be another secondary curve. And then the sacral curve at the bottom here, for this section here, that's going to be a primary curve. That's one that you're born with. So when you're born and you're a baby, you can curl up into a ball fairly easily, and that's because of your primary curvatures that you have in your spine. The secondary curvatures do not start to form until you start to hold your head up and until you start to walk. So looking at some basic vertebrae that we're going to find in each section. The cervical vertebrae are going to be thinner, and you notice here they have a smaller body to them, and so this is referred to as the body. They are going to be a different opening shape there for that foramen. That's going to be where the spinal cord is going to go through it. You're going to have different processes. This one, notice you only see what's referred to as the spinous process. there. The other ones are not going to be as prominent as, let's say, these right here. Those are referred to as transverse processes. And so notice how they stick out more with the thoracic vertebrae and with that lumbar vertebrae. With the lumbar vertebrae, it is going to be the largest vertebrae in the spinal column, and it has the largest body here to it. That's going to be very important because it's going to be carrying the weight of the entire upper portion of the body. So the body of the actual vertebrae, which is the section that I circled, has to be able to hold that weight. And so it's going to have a larger intervertebral disc that sits on there, and it's got that big body to help distribute that weight. And so looking here at some of the basic parts of a vertebrae that you do need to know. So this arch here is going to be referred to as the vertebral arch or vertebral arch, however you want to say it. This is going to be your spinous process. That is what you see when you bend over and someone's looking at your spine, that spinous process. You can have articular processes sticking out. You could have a superior or an inferior spinous process. Then you can have transverse processes on the side. In the center, the hole or the opening is going to be referred to as the foramen. And so that any hole, remember, is going to be a foramen. This section right through here is going to be referred to as the pedicle. This section through here and kind of through here is referred to as the lamina, or laminae. And then, of course, you have your large vertebral body there. So those are some of the major parts of a typical vertebrae. Looking at it from the side, you see how you have, let's get our pencil up. You have that superior articular process. This is that side process. You don't notice it as much sticking out the side since you're looking at it from a side view. You see that spinous process. Then you see those inferior articular processes. They have a flattened surface here. That's referred to as a facet that does articulate with a rib. You have the large body. You're going to have the vertebral foramen, which is going to be the hole that the spinal column comes through. This going around this section here between the body and the transverse process is going to be referred to as the pedicle. And then also looking here, you're going to see that inferior articular process. I don't know if I circled that one before. All right. So here's another one looking down. This is going to be an inferior view. So you're looking at it from underneath. And so it still has some of the same things there, but it looks maybe just slightly different. All right, putting it together, you see how they put the intervertebral discs in there. And so those discs are going to help with just padding between each of these vertebrae. So notice how it kind of goes all the way in between. Now, sometimes there are conditions as people get older where these can actually start to ossify and cause a whole section of the vertebral column to become ossified, and therefore they can't bend or can't move it because it is all turned to bone. So it's not flexible at all. So here in this picture, we're looking at a lateral view again. So we're looking at it from the side. The top section, they have actually done a cut. So they've cut away. So you can see how this is spongy bone on the inside with compact bone going around the outer portion of it. Also shows you a good look at what the inside of that intervertebral disc looks like. It shows you the inside of what the actual vertebral section or vertebrae looks like. And then down here, this is what it looks like from the outside section. So it shows you here how the intervertebral discs keep the vertebrae from touching each other. And then, of course, looking at it, if somebody was touching or running their hand down your spine, they would be touching these sections here, which are referred to as the spinous processes. If you were looking at the side view here, it's harder to see, but you have your transverse processes there. They're sticking out to the sides, whereas that spinous process is sticking directly out the back or towards the posterior part of the body. All right, so looking here, this is going to be the top section of vertebrae. So this is your cervical vertebrae, and they are numbered, and that's how they have their names. So they're referred to as C1 through C7, or you can call them C1, C2, C3, and so forth. Now, with these, there are two that do have their own name, and these are the only two of the vertebrae that have their own name. So the top one is going to be called the atlas, and then the second one is going to be called the axis. Remember, AT comes before AX. So atlas. And then the one below it, that didn't write, that should be an S right there. This one is the axis. That's an S. Does not like my S's. Okay, so know those two. The others, simply C3 through C7, or sometimes it's just referred to altogether C1 through C7. All right, so looking here, we're going to see the typical cervical vertebrae. This is going to be what C3 through C6 look like. And so notice the typical features. We're going to have the spinous process. That's what, if you remember, you were to run your hands down somebody's spine or touch the back of their neck, that's the part you're going to be able to feel. Notice how the transverse processes on these don't really stick out that much. They do have a special feature called the transverse foramen here, and that's going to be openings for the allowance of the different peripheral nerves coming off of the spinal cord, as well as veins and arteries, so the vessels can intertwine through those. You have your large vertebral foramen. With the cervical vertebrae, it's going to have a smaller vertebral body because it's only holding the weight of the head, so it doesn't need to be really large because it hasn't picked up a lot of weight yet from that body. You have your vertebral arch, you have the lamina there through this section, you have the pedicel here through this section, and notice how that you will have these articular processes sticking out on the side. And then you have flat sections, which are going to be your facets there. Right, and this is just going to be a lateral view, so we're looking at it from the side. Notice how that arrow is showing you how the different vessels can intertwine through that transverse foramen. You can see the inferior articular facet there, kind of from the side. It's going to be flattened right there where that line's going in. You have that spinous process coming out. You have the transverse processes coming out, but they're going to be very small. They have that foramen there, right there beside them. And then you have your vertebral body. All right, so here we're looking at the two very special cervical vertebrae that kind of have their own shape. The top one, remember, is going to be called the atlas. That one is C1. And so it has this shape right here. It's going to be kind of a pinkier color coming around. Notice how it has, hold on, let me move this out the way. Okay, it's going to have, the transverse ligament, which is going to be a ligament that holds that atlas to the axis. Coming up through the center between this ligament and the actual bone is going to be this section of bone here, which is called the dens. That is found only on the axis. It's kind of like a little ball, or almost looks like a little joystick if you ever played any older games like Atari. It is just a little nub that kind of comes up, and that is going to allow you to shake your head in a no fashion. So you can move your neck or your head back and forth like you're saying no because of this special feature that you see here. Right? So looking here, it's putting the thoracic vertebrae together here. Notice how in between you see those intervertebral foramen. You see the spinous process coming out the back section, so you know that if someone were to bend over and you saw their spine coming out the back, that's these little pieces that are coming out here. what you're looking at from the side, here and here and here, those are the transverse processes. All right, so this one's showing basic features of a thoracic vertebrae. Notice how that spinous process is still sticking out in the back. Oops. Didn't pick up where I wanted it. Let's try that again. All right, the spinous process picking up out of the back. Notice how your transverse processes have gotten much larger. The vertebral or vertebral foramen is there. Notice how the vertebral body has gotten much bigger. It's starting to carry more weight, and it's also going to have a larger intervertebral disc there. You see the superior costal facets, which are going to be on the sides there. And then you see here those superior articular facets. These are going to be flattened sections that are going to come together with other bones. And so the facets are going to be flattened sections that do that. Looking at it from the side view, notice how that spinous process sticks down a lot further, almost like it's pointed down. The transverse processes are still coming out to the side, but they look much higher from the side or lateral view that you're sitting there and looking at. And moving on down to the lower section or the lower back, which is referred to as the lumbar section. And so with the lumbar section, you're going to have L1 through L5. Notice the intervertebral discs that are going to be in between there, which are in black. And then you're going to have your sacrum, which is going to be 5 vertebrae that are fused, and then your coccyx, which are going to be 4 fused. And so always remember that when you're asked the numbers, cervical is going to be 7, so think of breakfast. Thoracic is going to be 12, so think of lunch. Lumbar is going to be 5, so think of dinner. So breakfast, lunch, dinner, and then of course sacrum is 5 fused and coccyx is 4 fused. You have to put the fused in there because they are not separate vertebrae. For the separated vertebrae, you're going to have 24 total, and then you'll have 9 fused total. All right, so moving on down, looking at the typical lumbar vertebrae, these are going to have the largest vertebral bodies to them, so they're carrying the weight of the entire upper portion of the body. The vertebral foramen is going to be in the center. Notice that you still have your transverse processes. The superior articular process and superior articular facet is going to be up kind of a lot larger, and then you see that spinous process. So these and all in all are going to be your larger vertebrae. And here it is looking at it from the lateral or side view. So here's your 3 basic that we covered. The cervical vertebrae are going to be thin. They're going to be more fragile-like. They don't carry a lot of weight. They're going to help you move your neck around and your head. Then you have the thoracic vertebrae. These are going to be the ones that articulate with the ribs. They're going to be found in the thoracic cavity. They're going to be of medium size. And then moving on down to the lower back with the lumbar vertebrae, these are going to be much thicker, much heavier. They're going to be able to carry the weight of the entire upper portion of the body. And so you see that in them as being a heavier, thicker bone. Moving on down to the sacrum, you're going to have what's referred to as the medial crest that goes down the center. So that's one of the first things. Wait till it kicks in. That's one of the first things that is going to help you identify whether it's going to be an anterior or posterior view. When you're looking at it, that's an easy one to look for. So always look for that lateral crest. Then you know that that's what you would see if somebody was standing with their back towards you. You would see that on that bone. Then coming up from the top, you notice the entrance to the sacral canal. That's where the end section of your spinal cord is going to go in. You have articular processes on top. You'll have what's referred to as a sacral tuberosity. You have side crests that kind of stick up, so they're referred to as lateral crests. You have sacral foramen or foramina. That's just for the smaller ones. You could say it either way. So those are the ones that are also going to have the nerves and the different blood vessels weaving through those, going down to the lower portions of the body. And then you have this one section here called the sacral hiatus. And that's going to be important to know. And then coming into the coccyx, you just basically have the coccygeal cornu, and that's going to help it fit in with the sacrum here. And as you see, it's going to be 4 bones that have been fused together. Here it is, looking at the sacrum from the side. Notice how it's curved. And so that coccyx curves in. And so going across the top part of the sacrum, you're going to have the base. And then the bottom part of the sacrum is going to be the apex. Now, lots of times you think of tops of graphs when you're looking at them as the apex. Well, apex is simply going to be where it comes to a point. Usually you're looking at the point. If you're looking at a graph, you would refer to that as the apex. But with some of these anatomy things we're going to be looking at, the hump or the rounded section is going to be at the bottom. So that's the apex. And the top part actually here, the more flattened part, is going to be the base. Now going into the thoracic cavity. The thoracic cavity is going to have quite a few parts. First, we have our ribs. You're going to have 12 sets or 24 total. The first 7, or ribs 1 through 7, are going to be, I keep trying to draw before it kicks in, right? So 1 through 7 are going to be referred to as your true ribs. And then 8 through 12 are going to be referred to as your false ribs. So these through here. And actually 11 and 12 even have their own name other than false ribs. They're going to be referred to as floating ribs. So the space that's found in between each of these ribs that you see here and you see here, all this space is going to be referred to as intercostal space. Now, if you like to eat things like ribs, that's where you're going to find the intercostal muscles, and that's actually going to be the meat that you're eating for ribs. They're going to be the meat on these bones. So that's the intercostal space, and this here is going to be referred to as the costal cartilage. And so that's going to attach the ribs to the sternum. And so the sternum is referred to as the breastbone, and that's going to be that section through there. And so your 3 main parts of the sternum are going to be the manubrium, which is the top part, the body, which is the middle part, and then the xiphoid process at the bottom. And so here is just another view of what it looks like. Now, to add to some of the things that you need to know, you do have this section here on the manubrium, which is called the jugular notch. Then you have these side indentions or notches, which are referred to as clavicular notches. They come and articulate with the clavicle or the collarbone, as we refer to it as. You have that manubrium there. This that separates the manubrium from the body is called the sternal angle, S-T-E-R-N-A-L, the sternal angle. You need to know that. Then, of course, you have the body. And then this section that separates the body from the xiphoid process is referred to as the xiphosternal joint. And so that is a xiphosternal joint, and then you have the xiphoid process. So sternal angle up top here, xiphosternal joint down here at the bottom. This is a view of it from the posterior section, or you're looking at it from the back. Your T1 through your T12, those are the ones that are going to articulate with each rib. Then the L1 starts the lower back, and it does not articulate with a rib. Looking at that rib up close, notice how it has articular facets, With those, they're going to be flattened sections that will articulate with other bones. The top of it's called the head. The skinnier section below the head is called the neck. You have a little hump that sticks out, which is called a tubercle. When it starts to curve, that's going to be called the angle. There is a groove or an indentation that runs along the side called the costal groove. And then the main part is called the body. And this is what ribs look like for the basic ribs 2 through 9. Okay, so certain disorders. So sometimes the normal curves of the spinal column may become exaggerated, and there's going to be many causes for these changes. The curve is going to be related to pathologies that include things such as scoliosis. That's going to be increased lateral curvature, and we'll look at these in a minute. And so that means it can basically curve to the side instead of being a straight spine. You have what's referred to as kyphosis, and that's looking at it straight on. So this is if you were looking at somebody's back, it kind of looks like an S. So kyphosis is increased thoracic curve bending forward. And so that's going to be in the upper portion of the back. And so it kind of makes them look like they have a humpback. And then you have what's referred to as lordosis, and that's where the spine's fairly straight, and then it curves in a lot in the lower back or the lumbar region. And so here's what those look like. So our scoliosis kind of makes that S. It has a lateral curvature. Kyphosis curves at the top, so it gives you a hump. Lordosis will curve in the lower lumbar region, so it kind of makes the buttocks stick out a little bit. And it looks kind of humped on the top sometimes. So here you see a section. Sometimes some people, their spinal cord does not completely heal, or it's not completely enclosed. And so you will have a little hump that you see here. Sorry. Let's go back. So you see that little section, that's where the spinal fluid, the spinal nerves, and some things can kind of bulge out and leak out there. This is referred to as spina bifida. It could be from extremely severe and really bulging out there and could cause a lot of problems to not as severe and kind of barely coming out. So this is going to finish us up for the axial skeleton. Make sure you notice or take note of all the different sections that I told you to take note with. Know all those different parts, such as all the different parts of the sternum. Know the vertebrae. Know the ribs and which each one, the numbers, what they're called, and things like that. And I will see you back here when we start talking about the appendicular skeleton. So we'll pick up with the pectoral girdle, the arm, wrist, and hand.